client with a kidney disease was scheduled for kidney biopsy. Which of the following is most important for the nurse to take? Select all that apply. The way I do select all that apply question is usually read the question backward, as we usually do with ADAPT NCLEX. So we read it backward, select all that apply, set the question. What is the being asked? Which of the following is most important for the nurse to take? So I need to take an action. That is my action. Okay, that's what it's asking of me. A client with a kidney disease was scheduled for what? Kidney biopsies. What is the case? The patient is going to have kidney biopsy, and I need to take certain actions to ensure that there's no morbidity or injury. And you can see that there is most here. So this is a priority patient in the form of SATA. Therefore, you have to make sure that you're doing something that will prevent morbidity. Then you ask for your buzzwords. The keywords is most important, kidney biopsy, and what actions I need to take. And then before you look at the answer choice, sit down and come up with your content. That means rewrite the question so that you can take ownership. I just need to take action for somebody who is having kidney biopsy. And what is the key things you need to know? The kidney is a vascular organ. That means it has a lot of blood. If you stick a needle and take a biopsy, well, it's going to cause a problem. They're going to bleed post-op. So bleeding is a major problem for these patients. So before the procedure, take actions to prevent bleeding. After the procedure, take action to prevent bleeding. Those are your key facts. Therefore, any answer choice, if it's preventing bleeding before the procedure, after procedure is preventing bleeding, you have to choose it. Number one, position the client in the prone position. That means face down after the procedure. The kidney is usually located on your back, the back side. Okay, if it's located on your back side, after the procedure, we need to put pressure on the kidney. But because the kidney is located on your back, you can't put pressure over there. You can't use your hand to put pressure there. You can't put gauze on it to put pressure. The best way to put pressure is to put patient on their back. They themselves, their body weight can put pressure on their back and prevent the kidney from bleeding. Prone position is what we use to do the biopsy. After the procedure, put them on their back. And therefore, supine is the best answer. So this is wrong. Ensure client has consent. Of course, nobody can do a procedure without a consent. You are not responsible for obtaining the consent. All you care about is witnessing the consent and making sure patient understand the procedure, and make sure there's consent in the chart before the doctor do the procedure. So your job is to ensure patient has a consent, but you don't obtain it. So this is a good action. Ensure client has a consent. I did not say the client you need to obtain consent. You ensure there is a consent. That means you're making sure there's a consent in the system. Check CBC before the procedure. Is this preventing bleeding? Yes, of course. CBC, usually you have white count, WBC here, you have hemoglobin here, you have hematocrit here, and you have platelet. We need to know whether the patient platelet is low or to prevent bleeding. If platelet is low, yeah, we have a problem. I will not let this patient go to the procedure because then they cannot form a clot. So it's very important I check a CBC to make sure we have a normal platelet. So good. Check PTT, PT-INR before the procedure. Yes, even patients who are not taking, they are not taking Coumadin. Some people PT and PTT or INR, or whether they're taking heparin or Coumadin, is usually can be high. The PT INR is for the Coumadin, and the PTT is for heparin. Because they are in the hospital, they may be getting heparin sub-Q. You don't know. But it's okay to check those levels. People take herbal tea medication, they're taking herbal medications that can increase their PT, INR, the Gs, the herbal medication, ginkgo, ginseng, all of them. You don't know what they're taking. So you need to check those levels to make sure they are not that high before you stick a needle in the kidney to cause bleeding. Therefore, this is also good. So we check this. Keep the patient comfortable in a semi-fowler position for the procedure. No, the patient usually are in prone position during the procedure. Okay, so they have to be in the prone position now for the procedure when the procedure is going on. Therefore, semi-fowler position, no, it's not comfortable, and then they may cause more injury. So we put them in the prone so that they don't move as we stick their back. So this is wrong. Ensure client void before the procedure. This is a trap. Okay, the kidney, where the kidney is located, is at your back. Your bladder is way here. The reason why you void is to prevent injury to the bladder. But usually, unless the patient is in the fowler position, when you're doing the procedure, yeah, they're sitting upright. And then when you go in, you may injure the bladder. You do this with paracentesis. This is not the same as paracentesis. Ensuring a client void before the procedure is paracentesis procedure, not a kidney biopsy. Kidney biopsy, you go into the backside, retroperitoneum. You go not going to the abdomen, the peritoneum layer, which require ensuring patient emptying their bladder, which is good for paracentesis. Therefore, we don't do this. Flank ecchymosis is expected after the procedure. Guess what? What do we say? Bleeding is a major problem. When the kidney is bleeding, it doesn't come into the abdomen, the peritoneal layer. It goes into the retroperitoneum at the backside. When you go to the backside, you can track into the belly button or the flank area. And you have ecchymosis there. Any ecchymosis in the flank or ecchymosis in the periumbilical area near the umbilicus is hemorrhage. The patient is what? Bleeding. Flank ecchymosis is called gray Turner sign. This is gray Turner sign. And periumbilical is called Cullen sign. If you see any of them in the patient who has kidney biopsy, yes, those are bleeding. Therefore, this is not expected. No. Periumbilical ecchymosis after procedure is not expected. Those are hemorrhage. You should be taking care of this patient and intervene as soon as possible. Assess urine output, level of consciousness, heart rate, respiratory rate, MAP after the procedure. Those are signs of bleeding. These are what you do after the procedure. After the procedure, you have to make sure the patient systolic blood pressure is okay, or you're checking their MAP, you're checking their respiratory rate, you're checking their heart rate, you're checking their level of consciousness, you're checking their urine output. You don't want their systolic blood pressure to drop. By the time you get there, patient is already in shock. When your systolic blood pressure drop, you are in class 4 shock. I don't want you to get to class 4 shock. Class 1 shock, you see like the respiratory rate goes up. And that's your early signs. They worry about it. Or the level of consciousness, it's a little bit of it. There's change. There will be diaphoretic. The certain change, autonomic dysfunction will start to occur. But respiratory rate will start to go up. And then heart rates follow before your blood pressure comes in. If your blood pressure is low, you're already in shock. So, and then they can trick you. They can give you low urine output. If they give you low urine output, that is a sign of patient bleeding. If their level of consciousness is changed, they're bleeding. If the heart rate is changed, they're bleeding. Respiratory rate is changed, they're bleeding. If their mouth is changed, they're bleeding. So you got to check all of them. Now, number 10, hold aspirin, NSAID, Coumadin, heparin after the procedure. Well, you want to prevent bleeding before the procedure. You want to prevent bleeding before the procedure. But how can you prevent bleeding in both situations? You take action before in this situation. I don't want them to have the aspirin on board or NSAID or Coumadin on heparin during the procedure, and now I'm stopping it. This needs to be stopped before procedure, not after the procedure. So this is wrong. Hold metformin before the procedure. This is a trap. We are not giving any contrast here. We're just taking a biopsy of the kidney. Okay. We don't need to hold metformin. Okay. We are not giving them any anesthesia, general anesthesia. We're just giving them what? Local anesthesia to biopsy. So there's two things that is clean to know here. Metformin, general anesthesia is not good. Okay. And two, if you're giving them contrast. In this situation, we are not giving them contrast, and we are not doing general anesthesia. It's a local anesthesia taking the biopsy. Even though it's related to the kidney, you don't need to hold it. It's a trap. Ensure client has at least 80 gauge needle and type and cross match after the procedure. Guess what? You're taking action to prevent bleeding and before the procedure and after the procedure. Putting 18 gauge in and getting type and cross match after the procedure is too late. That is you not paying attention. We want you to have 18 gauge in before the procedure and then type and cross them so that we have blood available for them. When they're bleeding, we give it to them right away. You don't want to wait until they're bleeding before you start to give them O negative blood. No, that's not a smart move. I need to get type and cross in. I need to have 18 gauge in, and so that when they bleed after the procedure, I'm ready to fight. And so that one is not a good idea. Therefore, recap. Ensure a client has 18 gauge needle, type and cross after the procedure. This is wrong. Hold metformin before the procedure. This has nothing to do with it. Hold aspirin, NSAID, Coumadin, heparin after the procedure. Too late. No, you got to hold it before. Assess urine output, level of consciousness, heart rate, respiratory rate, map after the procedure. Yes, you're looking for shock, for bleeding. Good. Periumbilical ecchymosis expected after the procedure. No, it's not expected. That is hemorrhage, bleeding. Flank ecchymosis is expected after the procedure. This is hemorrhage. No. Ensure client void before the procedure. This is not paracentesis. This is kidney biopsy. It's a trap. So no. Keep the patient comfortable in a semi-fallow position for the procedure. No, they are in a prone position, okay, during the procedure, for the procedure. So this is wrong. Check PT, PTT, INR before the procedure. Yes. Check CBC before the procedure. Yeah, to check their platelet. Ensure client has a consent. Yes. Position the client in the prone position after this procedure. This is hemorrhage. This is a B-sharp moment. If you see a patient who has kidney biopsy and you have them in a prone position after the procedure, you have to see this patient first. You have to see them. So this is bleeding. And lastly, I don't know how I want to say it. Any patient whose blood pressure is not controlled, hypertension, uncontrolled hypertension, is a contraindication. Contraindication. That means you cannot have a liver biopsy with uncontrolled. So you have to make sure. I was running out of space. I was going to hide it. You have to make sure your blood pressure is well controlled. So you can never have a kidney biopsy with hypertension uncontrolled. So you have to avoid that. These things is the same thing if they give you a liver biopsy. You just have to change the position. The same thing. The only position for the kidney biopsy, for the liver biopsy, they're on their back and they do the procedure. So in supine, when they do procedure, and then after the procedure, put pressure on the liver. The liver is on your right upper quadrant. So you put them on the right side down. So right lateral decube. So they put pressure over there. Okay. So this is sort of question. This is how you do it. You come up with your content, you attack each segment, you don't compare, and you break each one down. You make a decision. I did not compare anything. I just use my content, bleeding, bleeding, bleeding. If you're bleeding, I'm picking you. If you're not bleeding, I'm picking you, and I'm looking for trap. Take care of yourself and check ADAPT NCLEX for more of this kind of select, apply. We have great resources for next generation too in terms of select, apply. So see you later and all the best of luck. Thank you.